If you've ever struggled with any kind of carpal tunnel syndrome or pain in your hands or forearms around your wrists, then this video is for you. My name is Kevin and I'm a 23-year injury-free Ironman triathlete and coach. I've spent my whole career working on preventing my own injuries and staving off any chronic pain. And what I have found is that rolling out the muscles is the key and what I attribute to being injury-free for so long. Now, what's happening in carpal tunnel syndrome is the tendons right here toward the wrist tend to get really knotted up and swollen and inflamed, and it causes pain through the hand, pain through the forearm. And what a doctor will do for carpal tunnel syndrome surgery is they do an incision. I've actually been in the surgery and I've seen this, and they cut the tendon, which it's a disgusting surgery to say the least. And we don't want that for anybody if we can at all help it. So what I would like to recommend is rolling out the muscles on the front side of your forearm, because that's what's usually activating your hand. Okay, you can also roll the muscles on the top of your forearm, but I think it's on the underside of your forearm where you're going to have the greatest effect. So give this a try. We're going to start with a soft foam roller on a tabletop, and we're just going to roll the underside of our forearm back and forth. Now, as I'm rolling, you can see my fingers curling. I'm not doing this voluntarily. This is what happens when you put pressure on the muscle, which then pulls on the tendon, which then activates the muscles in the hand, and that's what's making my fingers curl up. And this is how I'm just rolling out. I'm trying to release the knots in the lower part of my forearm, which can then release the pressure on the tendon, so the tendon won't have to inflame to react. And then when the tendon is trying to pull out of bone all around in this hand and wrist area, it won't do that as much because the muscle is not knotted up. Now, if I want something a little bit more aggressive, I can go with a Nalgene bottle. This is a hard surface, and I'm just doing the same thing, finding the spots. I'm rolling my arm out a little bit. I can actually feel that. Roll my arm straight, and then try and get more medial. See, I'm getting a little bit lower so I can get the angle and get more medial on my hand. We're going to do the same thing on this side, just for posterity. And just roll out those muscles. It should hurt so good. Remember, whenever we're doing any kind of foam rolling of any muscle in our body, we want the muscle to be fully relaxed. So just relax that muscle. See how my fingers are curling up as I hit the lateral side. My pinky and fourth finger are curling. And now I'm going to try to get more my medial side. So oh look, see my index fingers curling a little bit. And then straight on top. So give this a try. If you've got any kind of forearm, wrist, carpal tunnel syndrome, then this could help you a lot and prevent taking more drugs and having surgery done. Of course, you can always consult your physician or physical therapist, but give this a try. You can even do it with a rolling pin in your own home at any age. So let us know how it's working for you. Leave a comment, like, and share this video with your friends and family. And hopefully you'll be feeling a lot better with your carpal tunnel or any other issues that you're having in your lower forearm, wrist, and hand. Until next time, peace, love, and connect.